we've just released some preliminary data that was presented actually at the ACTRIMS conference earlier this year. There will be additional papers coming out soon, but the core philosophy of the study is trying to look at existing imaging, which in most cases for people with MS involves MRI technology. Is there any way that we can look at a series of images from people with different forms of MS and start to be able to maybe predict who will have maybe a more mild course with their disease process and who will possibly end up having a more progressive form of the disorder, which in our case here is almost everybody who lives in our facility. They're considered as either having primary or secondary progressive MS. So we've teamed up with a group out of Buffalo, New York. We were connected by actually a family member of one of our residents here at the Boston home who now lives in Buffalo and is on the board of trustees with the Buffalo Neuroimaging Analysis Center at the University of Buffalo. So he connected us with Dr. Robert Zavadinoff, who is a neurologist and a researcher at the University of Buffalo and the director of the BNAC Center. And we have been able to complete the first of what we're hoping to be 3 phases of the study. First phase is more observational. We've collected a group of MRIs from about 53 of our existing long-term care residents here with advanced MS. And then the team in Buffalo found 53 age and sex-matched controls, meaning individuals with MS, but more mild physical symptoms, who also had existing imaging on file. They have created their own specialized software to analyze what exactly the differences might be between the MRIs. They also did blood draws for both groups to do some genomic sequencing and to look at a couple of biomarkers. There weren't any major statistical differences on those parameters, but one thing that really has starkly come out from comparing the imaging is the fact that most of the time when people are measuring the progression of MS, they look at damage to the white matter, to the nerve cells that kind of transmit information throughout the nervous system. In reality, it seems that the amount of physical disability in MS is more related to the number of gray matter lesions. So the actual nerve cells that tell muscles what to do and then interpret sensory signals. There's a significant amount more of gray matter damage, as well as overall cortical atrophy or shrinking in the central nervous system among people with progressive MS, especially those who are on that EDSS scale 7.5 and beyond, compared to people who have more mild physical symptoms related to MS. Maybe they're in that 1 to 4 range on that same EDSS scale. At this point, again, it's a more of a retrospective study because people had MRIs done in a number of different areas, a number of different protocols. We are currently planning for phase 2, which would involve actually having everybody, both a group from here in Boston as well as a group from Buffalo, receiving a higher resolution scan, either a 3 Tesla or possibly a 7 Tesla, which is the current max resolution, in the same exact scanner, ideally here in Boston, because it's a little bit easier to transport the group from Buffalo, then and look at more individual differences that might be evident at that point in time, and then repeating the scans 12 months later to see if there's evidence of, for example, additional gray matter deterioration in the group with progressive MS versus the group with more mild physical symptoms, et cetera. So again, at this point, we don't have a timeline for that just yet, but we're hoping to have some additional data from because not only were the images analyzed during phase 1, but there was also a full neurological exam completed, as well as a neuropsychological battery completed with all of the individuals, both here in Boston as well as in Buffalo. We were able to have a tool developed by Dr. Ralph Benedict, who is a professor of neuropsychology at the University of Buffalo. And the initial norming data seems to show that there may be some clinical utility for what's called the auditory test of processing speed. So many of the tests that are currently used to analyze people who have cognitive deficits related to MS or other conditions require either some writing or some reading or some visual skill. This test was designed for people, many of whom are typical of the residents we have here. They may be legally blind. They may be unable to write due to physical disability. So the test only asks them questions out loud. And so it can be amplified for people with hearing loss. And the initial normative data seems to show that it is clinically sound. So we're hoping to get some additional data for that and perhaps be able to use that as an additional brief, repeatable screening tool that can be used to track cognitive changes in people with progressive MS.